Imagine you have just had your routine mammogram, and then you receive a call that says your report is abnormal. That can certainly make your heart race, can't it? Well, let us take a deep breath together. An abnormal mammogram report simply means that something on the image needs further investigation. It absolutely does not automatically mean you have cancer. Think of it as a flag raised by the radiologist, prompting a closer look. This could be due to many common and completely benign reasons. For example, some women naturally have dense breast tissue, which can make images harder to read. Or it could be a harmless cyst, a fluid-filled sac, or benign calcifications, which are tiny calcium deposits that are very common and usually not a cause for concern. Sometimes it is a fibroadenoma, a non-cancerous solid lump. Even scar tissue from a previous surgery or inflammation can lead to an abnormal finding. The radiologist carefully compares your current mammogram with any previous ones to spot new changes or areas that look different, and sometimes a slight change, even a normal one, just warrants a second check. So what happens next? Typically, your doctor will recommend additional imaging. This might include a diagnostic mammogram, which takes more detailed pictures, or an ultrasound, which uses sound waves to create images and can help distinguish between solid masses and fluid-filled cysts. Sometimes, a magnetic resonance imaging, or MRI, scan is suggested for an even more detailed view. If these additional tests still leave some questions, a biopsy might be performed. This involves taking a small tissue sample for examination under a microscope to get a definitive diagnosis. It is important to remember that each of these steps is about gathering more information to give you the clearest picture possible. Radiologists use a standardized system called BI-RADS to classify mammogram findings. This system helps communicate results clearly and consistently. For instance, a BI-RADS Category 2 means a benign finding, while a BI-RADS Category 3 means a probably benign finding with a recommendation for a short interval follow-up. It is fascinating to know that the vast majority, around 80 to 85%, of abnormal mammogram results turn out to be benign after further evaluation. This standardized approach helps ensure that every finding receives the appropriate level of attention and follow-up. Receiving an abnormal mammogram report can be unsettling, but it is a common step in the screening process designed to keep you safe and informed. It is a signal for more information, not a final diagnosis. The best thing you can do is to stay proactive, communicate openly with your healthcare team, and remember that these follow-up steps are there to provide clarity and peace of mind. You are taking important steps to monitor your breast health, and that is something to feel good about.